Okay, let's go on.
And don't get
All right, so patient or volunteer is at least 18 years of age, and they are submitting to a health assessment, and they are aware that they are being taped and submitted for college review. Corey, is this true? Okay, so I've washed my hands, identified the patient, provided privacy, and I told him that I'm going to be doing a complete health assessment. So the first thing I'm going to do while I'm talking to the patient, I'm going to be assessing all the scan, all the external features that I can see. Starting at the head, by talking to him, I can assess whether or not he neurological status, whether or not he's with us essentially. Then I'm looking at the eyes. Eyes are clear, no redness, no problems. He follows my finger with his eyes in all six quadrants accommodation. If I had a pen light, I would be looking in his eyes as well for that, but alas, I do not. And pressing down on the sinuses, making sure there's no tenderness there. If there is, I can use my pen light that I would have for transillumination, see if there's any serous fluid. Feeling TMJ, open and close your mouth. Close. Okay. Open up. Stick out your tongue. Move it side to side. Okay. Cranial nerve, 12 for the glossal, and I think it's 10 for the other one, for the uvula. If I had the otoscope as well, I'd be looking in the ears. External ear, normal. Patient has no complaints of any hearing loss, any hearing pain. Looking with the otoscope, it would be nice, pink, looks good, tympanic membrane intact, all that good stuff. All right. Examine the mouth, no lesions, no cracked skin, no palpated lumps in the neck. Swallow for me. Swallow. Okay. No tracheal deviation, midline's intact. Alrighty. You're evaluating lung fields, take a big deep breath. We're saying symmetric expansion, no crepitus while doing that. Now I'm going to auscultate all the lung fields. So I'm going to tell you take a good deep breath and inhale, exhale, okay? Okay, go. Out. Go. 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 Okay. Okay. Lung fields are clear throughout. No adventitious sounds noted. Now I'm going to be listening to the heart. I'm going to note the point of the apical pulse right here. Check to see. Let's see. S1, S2 identified. No adventitious sounds. If I had any reason to suspect any cardiac thing, we can get an EKG, look at that, but it seems pretty normal to me. Okay, would you please lay back so I can do your tummy? Okay. Checking the patient, making sure the contours are all even, looks like a normal stomach, no striae noted, no reason to suspect any type of fluid imbalance or ascites in the abdomen. Start by listening to all 4 quadrants. Okay, bowel sounds noted all 4 quadrants. I'm going to start with some light palpation, see if there's any masses, any tenderness identified. And go up in between the ribs, identify the spleen about here. Don't feel any tenderness, no inflammation, dullness upon percussion over the site. Okay. Seems pretty normal. Okay. Okay. And at this point, I look at the rest of the skin, look at his the venous return. Legs are warm, dry. +2 pedal pulses, palpable bilateral. No reason to think any kind of skin issues with that. And that's the quickie head to toe. 5 minutes.